Guys, so we are live.
All right, Abdullah, thank you very much. I will take it here. All right, Assalamu alaikum, everyone.
Walaikum salam.
Um, I'll start by introducing myself. My name is Khadija Tijala, the current president of the Gambian Students Association in Morocco, and also a final year master student doing diplomatic studies here in Rabat. Um, I'm going to be your host for this program today, and then our topic is going to be on mental health. As we all know, a few days ago, I believe on the 10th of October, we celebrated, International Mental Health Day, but we couldn't host this program that day for various reasons. So that is why we are doing it today. I believe this is very important because when it comes to mental health, many of us have, there are so many misconceptions regarding the topic. Sorry, let me turn off. Yeah, regarding the topic. So I think as young people, or should I say young leaders, I think it's very important for us to start, discussing about this topic, and then, sensitizing and then raising awareness. So it's like either left, Idrisa. If you're here, you can also introduce yourself before we let our panelists, introduce themselves. But okay, thank you very much for honoring our John, Alieu, Ikram, and Juana. We are hoping to have a fruitful discussion and then learn so many things by the end, inshallah. Because we have two medical students with us, and then one diplomatic students. So we are going to have the social aspect and the medical aspect of the topic you're going to discuss about. So Idrisa, can you please proceed and introduce yourself?
Pardon? I didn't get you clearly.
Can you please introduce yourself as our co-host for this program?
Oh, okay. Thank you very much. First of all, good evening to our panelists, Madam host here, and also the audience. I am Alieu Ceesay, a current year, second year physics student in the University of Mulay Ismail in Netherlands. And I'll be your co-host for today's show this evening. And we are also looking forward to the participation of all audience, and we also look forward to having a fruitful discussion in which people will have a lot to grab from this discussion. Thank you very much.
Thank you very much, Idrisa. And as you can see, myself and Idrisa are going to moderate this program, which is supposed to last for, I believe, an hour. So I'm going to let our panelists introduce themselves. So I will start from here, from my right to the left. Okay, Joanna, can we please have you first?
All right. Hello, everyone. So my name is Joanna. I'm a final year medical student at the Faculty of Medicine and Pharmacy in Rabat, and I come from Ghana. And I'm looking forward to share the little I know with you all, and also learn from the rest of the panelists. Thank you.
Thank you very much, Joanna. Ikram.
Hello, everyone, and nice to meet you, everyone, and thank you for the invitation. My name is Ikram. I'm from Morocco, originally from Marrakech, and I'm in my final year in my master's in diplomatic studies. I had a bachelor in public law. So I think, as Khadija just said, we're going to discuss mental health in a social point of view. And from my experience, we've had pretty much dealt with this problem since younghood. I think everyone does. So I'm happy to share my experience and my knowledge, and thank you so much.
Thank you very much, Ikram. And Aliu, can we please have you introduce yourself?
Okay, hello everyone. My name is Alieu Ceesay. I'm a 6-year medical student at the Faculty of Medicine and Pharmacy, Casablanca. Yes, and I'm so pleased to be part of this platform. And I would love to. I will also be sharing the little that I have learned, so far as mental health issues is concerned actually. So thank you so much for having me.
All right. So thank you very much, guys, for being here. And then our audience or viewers too, like you can follow us on YouTube, Instagram, or Facebook. And thank you very much, everyone, for being here. So, okay, I think we could just start right away. So, we are going to start by, before we dive into the topic first, I think, many people don't know the concept of mental health. So, we are going to start by maybe definition, like defining the term mental health, from a medical point of view, and then from a social point of view, like the rest of us that are not medical students, when we hear about mental health, Ikram is going to let us know, what exactly like comes to our mind, or how do we perceive it. And then Juana and Ali will give us a medical point of view regarding the concept of mental health. So I will start again from my right. Like, Juana, can you please tell us what is mental health?
All right. I thought you were going to say ladies first, but since you
That's
said
what I
start
wanted to say.
right, I'll just
My
accept my
God,
fate.
I'm going to put that aside. Don't worry.
All right. All right. So mental health has to do with a state of mental well-being. When we talk about mental health, it has to do with a state of mental health well-being that helps us to cope with the stresses of life. It helps us to learn well, to work well, and basically live a normal life. Okay, so
Mhm.
mental health is a part of our overall health as individuals. When we talk about mental health illness, we are talking about anything that affects a person's thinking, a person's mood, or the way a person feels for prolonged periods of time. So, in a nutshell, this is what mental health is, and this is what mental health illnesses are. So, yeah.
Thank you very much. That was insightful, Joanna. So let's hear from Ikram. Ikram, when you hear about mental health, can you please, give us a brief definition, or, for example, explain how you perceive the concept? For example, especially, why we did this? We invited, different nationalities so that we will know also, for example, in our home country, when we talk about mental health, for us, we have a different point of view of seeing it. Maybe, Joanna, it might be a little bit close. Maybe I think most of the African countries see this term the same way. So, Ikram, is good that you are here, because, like, we want to know from the Moroccan point of view, how do you guys, perceive this, and then, yeah.
Thank you. Well, for me, I will start from an international point of view since it's related to my studies. I think international treaties don't mention precisely what we mean when we say mental health. But I think when you look at it originally, it's the capacity of building a relationship with each other and being a representative or a participative person in the community. That means you can maintain relationships, you can work, you can add a value to your community. But here in Morocco, it's a little bit taboo when we talk about mental health, especially we have Islam. I think also Gambia, the majority are Muslims. I think
Mhm.
here in Morocco, when we say like someone is mentally sick, we say that it's impossible. He needs to pray or he needs to go or fast or something like this. We cannot apprehend the possibility of someone being mentally sick. It's a little bit of a taboo, as I said earlier, but we are getting there. The Moroccan community is getting to know more about mental health. I think in the 10th October, when we had the International Day of Mental Health, there were plenty of conferences here in Morocco. For instance, the UC School. I think also the Conseil International des Droits de l'Homme aussi. We had plenty of conferences, which means that Morocco is getting to talk about this topic, and not like the 60s or the 70s when it was a taboo and they say there were no medication, and when you say to someone like you went to a psychiatrist, he will think that you are being possessed or you have we cannot apprehend the concept, you know. So I think when we say what is mental health, I think, as I said earlier, it's being capable to maintain healthy relationships. Although sometimes there are people who are mentally sick, and they can camouflage it by having interactions with other people. That means you cannot sense when someone is really mentally sick if he tries to hide it. Nonetheless, it's the ability to maintain a healthy kind of relationships and being good with oneself. That means being comfortable in one's skin, I think. And thank you.
Thank you very much, Ikram. From what you just explained, is like I'll say okay, like Africa in general, then we have the same concept when it comes to mental health. So it's like a taboo. We are not allowed to talk about that, and then it's stigmatized. The affected ones are always ashamed, to come forward, to like even to say seek help, people cannot do it because they know they will be stigmatized, and then maybe yeah, so basically it's the same everywhere. So Aliu, can you also please give us a definition or help us understand mental health in should I say in a Gambian point of view, also a medical, maybe you can start from the medical, and then as Gambian, the Gambian society, how do you think we perceive mental health?
Okay, thank you so much, Khadija. Actually, I will start with the medical definition actually, but what I would say is like I will go with the WHO like definition of how to call it mental health. Actually, according to the WHO, it's like they said it's like mental health is a state of well-being of a person, that enables them to cope with the stresses of life, like realize their how to call like their capabilities, and how to call they're able to also like how to call it learn, you got it, and work well, like and also be able to contribute in the community. That's the definition of the how to call it, like the according to the WHO. Because it's normal. You're gonna be, life is like stress is part of life, but there's a way it's like your ability to cope with stress. You get it, that it doesn't affect the quality of your life. That's in brief. That's what they're trying to say. Because the moment it affects the quality of your life, it becomes pathologic, and there we can talk about some mental health issues and related stuff like that. So as far as my society is concerned, as far as Gambia is concerned, because how to call it, mental health issues, like they come in different ways, and for some, they present in different ways, anxiety, depression, all kind of stuff. But as far as my society is concerned, it's like it's kind of just like Ikram said, it's kind of a taboo, or like people kind of stigmatize you if you say maybe you're depressed. Tell you, hey, get out there, you're so weak. Hey, don't disturb people and stuff like that. People have more important things. Go and take care of yourself. So people, and it's like the only thing, maybe if somebody has mental health issues, like for them it's like a mad person, somebody who is outside the street, rip off their clothes and stuff like that. That's who they really consider to be like somebody who is mentally ill. But it's like they don't understand that mental health issues, like it comes in different forms. You get it, anxiety, depression, all those things, bipolar disorders, all those things. There are ways that mental disorders can manifest. But as far as society is concerned, like that's what they feel like. Anybody who is like outside the street, you're mad. You take off your clothes here. That person is mentally ill. Yeah. So generally, is that I think, yeah.
All right, Aliu, definitely. Thank you very much. I think I understand you better because we all know how our society,
Society is.
and then it's a topic that is supposed to be discussed more because many are suffering in silence, and then we are still not yet there. Many are not yet we are still not at a point where people can just openly come and confess or discuss their problems when it comes to this topic. So, thank you very much. That was very, very informative and insightful. I'm sure for many people who do not know like mental health like before, so at least now they have an idea. So, for the next question, I'm going to let Idrissa proceed with that. So, Idrissa, can you please take from me? Take from here, like, can you hear me, Idrissa?
Seems is.
Hello?
All right, thank you very much, Madam Jallo. think most of you gave wonderful definitions of what mental health is. And before I move on to the other topics, it is actually very funny. Like when you look into our society, the way they think, the way they take mental health to be, and the way it's like they only focus on one part of it and then forget the other one. Just like Mr. Sita mentioned here. Um, but anyways, I believe as we move on to the discussion, we might have things on how to remedy that, how to make our society aware that mental health is not only someone being mad or something, but actually it has a wide range of varieties. All right, so move on. I would like to know, and on behalf of the audience, I know most of the people might be having the same question in mind. What are the types of are there types of mental health issues, and what are the types or forms of mental health issues in this discussion? First, I would like to go by Ali.
Okay, you asked about the types, or I will talk about maybe the types or the various forms, in which like mental health can, manifest actually in a person. So actually, you can have like anxiety issues, like, depression. You get it? Yeah. Like how to call you have bipolar personality disorders. You can also have how to call it like addiction to certain type of like intoxications, and so it comes in different forms. Actually, I can say in different forms, like because you have mood issues. Like most issues, example is bipolar, and you have, as I said, depression. You can also have what we call like compulsive obsessive like this disorder. You can also have what we call ADHD, that is like attention deficit hyperactivity disorder. So all these things, they are forms of how to call it like how to call it mental health this how to call it mental health disorders. So they present in these forms, but there are more various forms. But each of these forms has certain how to call it like symptoms that they kind of present or orient like orient us like towards, okay, this person has this type of like mental health disorder or that, and that you get it. It's like they can have some kind of clinical clinical presentations. So it's not always like the symptoms are not always like apparent like that. They're not always obvious like that. So you don't have something like you can say that like this fix, okay, this symptom once it's there. Yeah, maybe for some, like maybe for depression, like in depression people, like we have what we call like anhedonia. Like anhedonia is a type of symptom. Is like if you see it in a patient, you can be very strong, like you can strongly evoke that, okay, this person has depression. Anhedonia is like, okay, maybe it's before you used to enjoy maybe watching a movie or something like that. You love it so much, you enjoy it, but you came to a point like you're watching this movie, like have you're no longer enjoying it. Like the things that initially like how to call it like fun. You found how to call it like fun in when you were doing them, but now that you're doing them, you're no longer finding like that fun, like that happiness, the release of dopamine and anything. You're no longer enjoying it. So it could be one of the signs of like a person is depressed, and loss of energy, like low concentration. People can have issues with also like sleeping issues. People that are depressed mostly they can either be oversleeping, we call it hypersomnia, or they can have like less sleep. Can have like they can be struggling to sleep, what we call insomnia. So they can be manifested in different types of ways. So bipolar OC, like bipolar disorders too, can also have symptoms like various symptoms. Because in terms of bipolar personality disorders, like we have different types, because we have type 1, type 2. So the type 2 is mostly like depressed, like depression state, because there are two phases in type 2. Type 1, is like actually in type 1 you actually have how to call it. There are two types. You can either have what we call mania, and you can have depression state. You get it? But like in type 2, there's more of like depression. Like its majority is covered by depression. So in this type of people, like in bipolar disorder, that is type 1, the bipolar disorder type 1 is like you can have mania. Mania is a state whereby the person is like over, joyous, they're so, this high energy and stuff like that. They can have that phase, in type 1. And another, maybe it can last for a few days, and they will go into a depressed state. You get it? So in type 2, actually that one is covered. That is majority of it, like it's mostly depression. So you have all these, anxiety issues too, and the likes. So it's quite a long range of manifestation, like clinical symptoms, but these are the various forms that there are others too. But I will leave Joanna probably to address on that.
All right. Thank you very much for the preamble. In fact, Dr. Ali he has said majority of the things. In fact, he has said it all, and I'm very happy to hear that. So when we talk about the different types of mental health illnesses, there are several ones. Okay, but we are going to focus on the most common ones that we find in society. And my colleague has already spoken about majority of them. I'll just add a few points to them from what I have, from what I know. Okay, so first of all, with the anxiety disorders, we have the generalized anxiety disorders. We have social anxiety disorders, panic disorder, and then we also have obsessive compulsive disorder. All of them are characterized by a severe sense of worry. When someone worries excessively about things, this is the common characteristics of anxiety disorders in general. Also, we have post-traumatic stress disorder. Like Aliu said in the beginning, stress is something that we deal with as individuals. It's a normal part of life. Okay, and most of us have stress as a reaction to certain types of trauma or difficulty in life, which happens to, each and every one of us in our life. And for some people, they are unable to overcome this stress as time goes on. So they experience post traumatic stress disorder that comes to them in forms of nightmares. Some of them can have things like panic attacks. They can have
Hallucinations.
flashbacks. Yeah, they have flashbacks. Some of them have extreme sensations of fear. Okay, from experiencing things like natural disasters. Some of them experience neglect in their childhood, different forms of childhood trauma. All these things are things that cause post-traumatic stress disorder. Also, we have personality disorders, which affect a person's thought pattern. Personality disorders, a person's emotional or behavioral thought patterns, and makes them deviate from what is normal in their society, in their cultural societies, and this has a significant impact on how they feel, how they are able to include themselves in society. We also have depression, like Aliu mentioned, and depression is not just about sadness as people think. That is just, a mere, few days of sadness. I mean, we all as individuals experience that sometimes. But imagine this is someone's constant way of life.
Default, yeah, you say it's their default mode.
Yeah, you can imagine how tough that is.
Yeah, it
You
can.
experience that for a few days and then it's like your whole life is falling apart. This is someone's regular, constant. So yeah, for someone to be diagnosed with depression, it has to exceed a couple of weeks before we say that okay, this person has depression. Okay. Then we have bipolar disorder, just like Ali mentioned, and it's not just mood swings. That's people normally say that women have mood swings, especially when they are in their period. It goes beyond that. It's not basic mood swings. It's
Just
it's an extreme form of mood swings, if I can put it in basic terms. So, like he said, there's type 1 bipolar and type 2. You have an exaggerated it. For manic, you have manic episodes and depressive episodes. So for your manic episodes, there are people that have a very inflated sense of self. They feel higher than they are, right? Some of them go and do outrageous things because they feel so excited. Then after a couple of days, they experience depression, and so on and so forth. And then the type 2, which is mainly depression, and then hypomania. Then we have obsessive compulsive disorder. For that, I mean, there's a stereotype about people who are squeaky clean. When we talk about obsessive compulsive disorder, there's a particular stereotype. People think it's about those who are always trying to get things neat, but it goes beyond that. It goes beyond that. People that have nagging thoughts, right? That keeps them anxious, right? Some of them are those who try to keep things clean. It's not just that, there are other forms. Okay. So I guess in a nutshell, that's it. We have psychotic disorders too, psychotic disorders and then schizophrenia. I don't know if some of you have already heard about it, but they are characterized by hallucinations, right? Seeing things or hearing things that are really not there. You can also have delusions in the sense that you have certain strong beliefs, even when there's evidence that they are not true, you still have these beliefs and you hold on to them tightly. You have those delusions. You can also have disorganized thinking, disorganized behavior. Those are classic symptoms of psychotic disorders and then schizophrenia. Then we have autism spectrum disorder. We have eating disorders too. The common types of eating disorders are anorexia and then bulimia, right? The way I think Ikram, because that has more to do with social stuff. So let me not talk much. I think Ikram has also prepared something good for us. So I'll leave it to also, yeah, enlighten us more on what those things are. Thank you very much for giving me audience.
Thank you. When you mentioned eating disorder, I was thinking about the FAO. I don't know if you know it, guys. It's the International Organization of Food and Agriculture.
Uh-huh.
Before, we had the problem with people dying from famine. We don't have people are not eating because there is no food. But in these days, they have this phenomena where people are not eating, even though we have enough food for everyone. People are not eating just to be skinny. So
Yeah.
there is this major issue that we are discussing, and the FAO has claimed that there is enough food for everyone, and they were culpabilizing her. They saying that the organization has not given enough food for everyone. But the organization says no, it's the opposite. The people are not eating. It's because they have their reasons. This is one, and for other international treaties and stuff, the problem is in the international legal department. There is no real definition of mental health, and there is no real definition of what types of mental sickness, mental illness there are. We only have one international convention. It's the United Nations Convention on the Rights of Persons with Disabilities. That means the CRPD. The nation signed this CRPD just to have people with wheelchair access to public administration and stuff. And we have only one small text at the end of this convention that talks about mental health in types. For instance, for students, we can't have more than 12, for instance, 8 hours of study in 1 week, in one day. Sorry. So when a nation, for instance, signs this convention, they take action for their students, their workers, in order to preserve their mental health. So we don't talk about the types of mental health, but we talk about how to preserve this mental health, even though we don't have a real definition of it, and we include it in disabilities, even though it's not really a disability. It's a sickness, and the World Health Organization, has claimed this problem, and it's always talking about that people need to be more conscious of this issue. We also have for children, for instance, as you mentioned, the post-traumatic disorder. For instance, when we have an international catastrophe or a catastrophe, a natural disaster, we have organizations that come only for insurance in a way, in a mental health way, not for health in the health, but in a mental health way. So, as to say, the international media or the international organizations claim that we have mental health, we have mental illnesses, but they don't take action. They just act by how do we say it, by an illegal way. They strive to make a change, but even though there is no real change. uh, Even though I didn't talk about the types of mental illnesses that we have, because we don't have really one type of mental illnesses. I don't know if you could get what I was saying, but and that's it. I leave the floor to Khadija, I think, or Idrissa.
Yeah, I wanted to add some other stuff. Is Khadija still here?
Yeah, I am.
Okay. It's like I wanted to add some stuff. It's like they said, like how they call it. As you saying, it's like your thoughts, like and feelings, they create your reality. So it's like the way that you think, can affect your body. It's very important. Like the way that you think, it's very important. And let's talk about stress. It's normal, like physiological, like in a physiological way. It's like as human beings, we know that God is like, I don't know, I don't want to go into, but I believe all of us here believe in the existence of God also. So God created us in a way that is like we have the capacity like to be able to handle stress on the physiological needs, because He knows that like at some point we are going to be exposed to stress. Like it can either be like sometimes it's like the way that your body is like how to call it, like, sense a threat. It's like you can, let's say it's like maybe a physical, like an actual physical threat, or you can actually have how to call it, like a threat is like another threat of like how to call it. Let me say, okay, maybe if you see like a dog that is barking, or maybe you see a lion, you get it, and you're scared. So what happened is like, what happened at that point is like it's like your sympathetic nervous system is going to be stimulated. Now, what this does is like you have what we call, it's like when this is stimulated, you are in a mode of what we call in the fight or flight mode, because you are ready to run away or either fight. There's a physical threat. Now let's look at this, like even the real life, how to call it, like the life responsibilities, like maybe your job, it's like, or responsibilities. All those things are also, the body sends them as a threat, like the way it sends like a physical threat, and it's going to respond in a similar way. But the way the body is created is like, okay, when you have this stressful situation or this threat that are kind of, it's like, they're triggering, it's like it has a way of dealing with this, but on the physiological means. It's like what happened, okay, if you see like a threat that like something that is like, it's gonna scare you or something like that, what happens first? It's like your body senses a threat. Now what happens is like the fear center of the brain, that's called the amygdala, is going to be stimulated. Now once that is stimulated, your sympathetic nervous system too is going to be stimulated. Now what does this does actually, that's what we call the release of certain hormones. We have what we call cortisol and adrenaline. Now, these are hormones that are actually released from your adrenal glands. Now, when you talk about adrenal glands, these are glands that are actually found on the top of your kidneys, because you have two kidneys. So on top of them, you have what we call the adrenal glands. Now, when you are exposed to a stressful situation, now these two hormones like cortisol and adrenaline are released. Now, what do they actually do to you? They help you to be able to cope with this stressful situation. What do they do? Now, cortisol, what it does is like it's going to increase your glucose level, like your glucose from what we call neoglycogenesis. It's like it's going to form like glucose from other sources besides carbohydrates and sugar. Now that is going to increase your glucose level. Why is your glucose level need, like what's the need for your glucose level to be increased when you see something fearful? What happens is like when glucose is, it's increased, what happens actually, you have what we call glycolysis. Now in glycolysis, the final product, I don't want to go through the process, but it's a long process, but the final product is going to give you energy that is in the form of ATP. Now you need that energy to fight that threat that is in your, that you are exposed to at that point, either being the stressful, like that threat can either be something physical or something that you actually like life stress, like situation, school, exams, and all kind of stuff. Your body senses it the same way like it sends a physical threat, actually. So that's what cortisol does. So it helps you to get that energy to get ready. Either you're gonna fight or you're gonna be in a flight mode. It's either you're going to run away or you're gonna fight. So the other one is adrenaline. Now what adrenaline does is actually, it's a hormone, but what it does is going to increase your heart rate. And when it increases your heart rate, your blood pressure also is going to spike. Why is it this happening? It's helping you to deal with the stressful situation that you have in front of you. So what happens is like your heart will start beating faster to be able to push blood to your peripheral organs. It's like, okay, imagine if you see something that is physically like a physical threat. What actually happens is like, if this like situation is like stimulated, there is going to be some kind of consequences for that period of time. Because okay, imagine you are eating something, maybe a particular food, you get it. But if you see something like a lion in front of you, the body is going to be like, you know what, I have to deal with this. We can digest the food later. So you get it. So at that point, it means you can have problem with indigestion because the food cannot be digested now. That energy is going to be used to be pushed to your either your hands or your legs and get ready to deal with the danger. So that's the way your body like sends this kind of like life stresses and stuff like that. But this has to be on the physiological like state. So if you are exposed to this like this stressful like situation for a long period of time, it can start to have repercussion on your own body. Your body can deal with this, or it can stimulate this, this mechanism, but within a physiological like means, like time. But if you are exposed to this stressful situation for a long period of time, you're always stressed and stuff like that, it can that can lead to like mental health issues. It can lead to anxiety issues and all kind of depression, all kind of stuff like that. So it can cause some kind of chemical imbalance and all things like that. So that is the way we are created. Like God created us in a way that we can handle these things, but under physiological means. It's like if it is beyond the capacity, it's like it's gonna cause you some kind of issue. So that's what I wanted to add.
I think when you mentioned this topic, it's related to also substances abuse disorder. When you are exposed to these kinds of stressful situations, people often tend to take refuge in alcohol or other substance usage.
Yeah, exactly. It's like a way of just trying to run
Escape
away,
reality.
escape
Yes.
reality. But just for a temporary period of time, it comes to haunt you again. Yeah.
Yeah. And that's when it becomes a disorder.
Yeah, and actually, those things is like they only have placebo effect. They don't actually physically have like effect. That they are taking away your problems like or things like no. It's just a placebo effect. It's just for a period of time, and then reality hits in again.
Yeah, that's why people become addicted. They take it to escape one after time.
One after the other. And they have to keep increasing the dose because if they take a particular dose, the problems reappear again. They have to increase that dose again.
Um,
Yeah.
Absolutely.
can we please? Thank you very much, guys. I'm so sorry. I think we still have so many questions,
Yeah.
and we only have less than an hour and a half. So, Idrisa, you've been quiet since like Ali and Ikram. Don't worry, we have so many questions on the way. You will have enough time, to make us to
Okay.
take us through.
So
Like we can see the passion you have for the topic, like the three of you, and then this is amazing. So people are already learning because people are enjoying the discussion because I'm following through our social media platforms, and then I'm reading some of the comments. So they are like, it's going on great, and then they are having fun. So Idris, do you have anything to say, to add on to what they say before we proceed to the next question?
Absolutely, absolutely. I have a lot of things to say, but I will just add a few. And and I also have one question to add in uh, after all that I was saying. It's actually interesting when Mr. Peter said that, in life-threatening situations, even though you have things that, you might be enjoying. And I believe this is actually true. No matter how comfortable you are, anytime your body senses anything that or it senses anything that is harmful to it, actually it reacts faster, forgetting about the positive that you are doing you know, rather than focusing on the positive, your body prefers to eliminate the negative so that you can continue on focusing on the positive. And I believe that is a wonderful thing to say. And I believe also one of the audience can be a witness to this at one time or another in their life. They might have experienced such things as well. And the question I would like to ask from here before we move on to the other one is, are there any ways in which an individual can identify if he or she is suffering from any mental health disorder? And I think it's very important that we discuss about it so that if I thought it will be necessary for individuals to check it on themselves so that they can identify these disorders as quickly as possible. And if I thought it requires any medical attention, then the need can be resolved.
Yeah, I would love to answer that. What I would say is like, as we just discussed, like with my colleagues, it's like we say that the mental like health, how do you call it, like issues, they present in different forms. You get it? There are different forms. You get it? And there's a criteria of diagnosis that we normally use in medicine. We call it like the DSM. It's like call it like the DSM. It's like it's a type of criteria that we use to diagnose whether somebody has a particular psychiatric or mental health issue. You You get it? So the symptoms are not always very apparent, but if I can say, it's like, okay, maybe in, like, let's choose maybe example like depression. You get it? Like, how should somebody be like oriented, like they have maybe like depression? Because it's something I know is quite common that, that most of the other things, some people, like, maybe they can be depressed, but they might not know actually. But I think this is something that people normally talk about on depressed and this and that. But actually, it's like, okay, for you to know somebody's depressed, or certain symptoms that you can have. One is like, you can have, how to call it, like loss of energy. As I talk about this here, anhedonia. Anhedonia is like, it's one of the most like tilt and common signs that shows that somebody is suffering from depression. It's like, what do you enjoy doing the most? Like, actually, I'm gonna ask you this because I want to make it practical. What do you enjoy doing the most? Like, what is something that you always like? You look up to when you're doing it, like you enjoying it. You feel it, you get it. What is that thing, that activity that you have that?
Well, there are various activities that
Okay, just
I
give me
enjoy
one,
doing.
just one actually.
I know dancing is
Well,
Yeah.
because the
yeah,
professor.
certainly that's one of them.
Uh, let's say maybe playing games, or like, how do you call it, like playing games, or maybe playing games with your on your PC, or you get it, things like that, or maybe enjoying playing football or something like that. And it's
Mhm.
something
I'll
that
say
you
reading.
like, you always like, maybe playing games on your PC example, you always enjoying it, you get it when you're doing it, you have. But it comes to a point, it's like you're doing it, but you're no longer enjoying it anymore. It's like you're not looking forward to it anymore. You get it? And it's like, this used to, it's something that normally like gives you, you enjoy doing it, but all of a sudden it's like you have no longer interest in it. It's not giving you any spike of, that dopamine anymore. It can be a sign that, you can be depressed. So it's a very common sign. We call it anhedonia, but it can have other symptoms that can be, accompanied by it. You can have, how to call it, sleep disorders. It's like you can struggle with sleep. You can either have what we call hypersomnia. It's like you're sleeping a lot or you're sleeping less. We call it insomnia. You get it? You can also have, how to call it, loss of appetite. You can lose appetite of food. You might desire, food less. And how to call it, you can also have, how to call it, you can also have maigrisme. It's like you can lose body. Like, it's like you can, how to call it, perdre de poids. It's like your body can be, you can. So
Weight loss.
all, exactly. So you can. There are various of other symptoms, that can accompany, things like this. So, but if you have these similar symptoms, these are things that, okay, you can be worried. And if you have any symptom that is affecting the quality of your life, you know, you can also go and consult. You get it? Because that is it, like mental health issues. They affect the quality of your life in any aspect. It's like if you were performing at 80, 90%, understand, of whatever thing you're doing, you get it, you find yourself like you are no longer able to deliver or do that thing, understand, even though you're doing it, but you can sense that something is, it's just not right. Because that's the implication of mental health issues. It affects the, how to call it, the quality of your life. And when you have depression too, you can also have issues like you can avoid social interaction. You might, you can withdraw a lot. You don't want to talk to people that much anymore. Because what happened in depression, I will tell you this. Normally, it's like, because we don't actually have these causes, deep causes. There's still theory and stuff like that. But what is this cause in depression? What they discovered is like we have what we call a neurotransmitter that is called serotonin. Like serotonin is kind of, it's like, I'll explain this. The brain, you have cells. The brain has cells, and the cells are called like neurons. Now the brain cells, they communicate, because cells itself, like the way I'm talking to you, our own cells too, like they communicate. They have a way that they communicate. Now the way the brain cells communicate is what we call, is like they have electrical, what we call electrical impulses. That is the way they communicate. It's like, okay, these are two cells. You have two neurons. We call them neurons. You get it? How do they communicate? They have a space in between them. How does the communication happen between them? It's like they have electrical impulses that pass through. Now, those electrical impulses, they are carried by what we call neurotransmitters. We have some of them. We have serotonin, we have dopamine, we have glutamate, we have what we call acetylcholine. You get it? But in terms of, as far as depression is concerned, I'm giving an example of depression. What is normally concerned is like serotonin. Now, this serotonin, what it does, actually, it's like people who have depression, I would say it's like they have a very reduced, how to call it, concentration of serotonin. Normally people who have depression, they have a very low, how to call it, like level of serotonin. So that's why when we give them medication, we give them what we call SSRE. SSRE, this what we call it selective serotonin recapture inhibitors. Like what it does is gonna be, it's like, because when serotonin comes to the, like, because when you come, two neurons are like this, they connect together through what we call, we have what we call synaptic junction. That's what we call a synaptic junction here. So they communicate through these neurotransmitters. Now when the electrical chemicals come in, it is transmitted by what we call the neurotransmitters. Now serotonin is like, when, if it transfers the electrical impulse to the other neuron, what happens is like there are other enzymes around here that breaks it down. So what we give, like we give medication, we call it SSRE, we call it the selective serotonin, how to call it, like recapture inhibitors. Now what they actually do is like they inhibit those enzymes from breaking down the serotonin, so we can have increased serotonin, so the person can feel good, because serotonin helps in the mood of the person, all kind of stuff. So that is how, I know there's a lot of physical, but I don't want to go deep into detail, but I'm just giving you a simple, like, and like one example, because if I want to go into the physical part, it take a lot of the time. You get it,
Looks
but
like you
yeah, but we don't actually have like typical, but I feel like maybe some other time, when you talk about these things, I think we still have more stuff, but I
Yeah.
think you get it in general, you get it in general. So each how to call it, each mental health issue, it can have some kind of like specific presentation, or general presentation clinically, so we
Uh,
can have symptoms that just orient us.
Ali, thank you very much. Idris, I'm so sorry. I think before we proceed, we can leave this question maybe to the end, because we are already 47 minutes in, and then we have less than an hour 30 minutes have, and then we still not yet, I think, touch the main, should I say, the central question of the topic, because our central question is going to be, education and mental health. As students, how can we help students with mental health conditions and stuffs like that. So before we get there, I think it's important, we just try and keep it very short. If not, we are going to run out of time. Yeah.
Okay.
thank you
So
very much.
thank you very much. Very, very, very insightful. I think you need a whole program for this.
Yeah, I know.
So
The
it's,
physical
it's
part is
so
all.
it's so unfortunate that, like, we don't, because of time, I don't
Yeah, yeah,
you.
sure.
Yeah. So, but
But
thank
I
you
can have
very.
a private session with Idris later if you want, no problem.
Inshallah,
Yeah,
I'm
if you're that
old.
inquisitive,
I
All
look
right.
forward to that.
Oh,
yeah,
can I?
yeah. Go ahead, Khadija.
All right. Okay. Just maybe Okay, less than 2 minutes for each, please. We just want to know what are some of the misconceptions, like, about mental health. Like I mentioned before, about when it comes to my own society, when you talk about mental health, people just think about, someone who is completely gaga, like crazy, people who don't wear their clothes anymore. So that is how, from my own society, that is how we used to. I'm sure, like, now things are evolving, but it's still there. So especially, okay, ladies first. From Ikram, like Morocco here, how do people, perceive, so what are some of the misconceptions of mental health?
As you said, Khadija, I think the main misconceptions has to do with religion. Sometimes we say, for instance, that you have the minimal. The pyramid of Maslow. You have your psychological need. That means food, water, breathing air. You have all these, and then you have security. That means you have a roof over your head. Then we move on to, for instance, clothes, and then your intimacy to a community. That means that shares the same language or the same traditions or the same, for also religion. As to in my country, when we talk about mental issues, we usually talk about: do you have enough food? Do you have a roof over your head? Do you have your family with you? Do you have your studies? Do you have everything you need? So how come you're sad, or how come you have disabilities? They ask these questions, but when you say yes, I do, but I'm suffering from, for instance, eating disorder or something like this, they say it's impossible. You don't mention Allah enough, or you don't pray enough, or you don't meditate enough. So I think this is the main misconception. Is the reason why you have mental illnesses has to do with something with religion. When you say that you are suffering from a condition like this, they usually say that you are sick in the head. That means you need to do stuff that will help you. They don't mention it as a real illness, you know. We don't prescribe medication. We don't say go see a doctor. We say go meditate or go sleep or go eat. So I think this is the main misconception. And I think Joanna is next. I pass you the floor.
Mm. Thank you, Ikram. Joanna.
All right, so I believe we are a bit short of time, so I'm just going to go through briefly. So there are several misconceptions, there are several myths that people have in their various societies or communities. From where I come from, people say that people that have mental health issues, particularly depression, are weak, especially if it's a man. They might think that he's a man, he's supposed to be strong. Why is he talking about depression? It's not about that. If you have a mental health disease like depression, it doesn't mean you are weak. Another one I hear often so is that you can just get over it. People tell you that with time it will just pass by. People actually need therapy, they need drugs to be able to come out of this. And it's no joke. People go through very severe things that they sometimes may not be able to talk about because of the stigma associated with it. But yeah, these are some of the things that I have heard, and I'll just leave the rest for Ali to touch on. So yeah.
All right. Thank
Um,
you, Joanna. Ali, go, please.
Thank you, guys. Actually, well, I'll just buttress on what they have already said. Actually, people need to understand one thing. It's like mental health issues can affect anyone, irrespective of how to call it, like your income, your religion, your intelligence, or how religious you are. It can affect anyone. Okay, religion can play a part. It can help you partially to deal with mental health issues. But if you have mental health issues, you need to seek medical help. Like people have this misconception in our society. No, yeah, just like Ikram said, because I'm a Muslim, I know this stuff. It's like, yeah, you're not religious enough. Are you praying? Are you doing your salah and stuff like that? Are you making, doing zikir and stuff like that? But it has nothing to do with that. Yes, it can help you jugulate that. To be honest, I would really agree with that because it's like we are created as human beings. We have three things: the mind, body, and the soul. So these three things are very important to keep in place. Like if you're able to create, like take care of them, it can really help you. But still, now it doesn't eliminate the fact that you cannot be exposed to mental health issues. Now, I think yeah, generally it's that because I know that people have this. We have this overzealous, religious people that will tell you, no, you're not religious or you're not praying or you're not, you're not that religious. That's why you have this. But no, even religious people can have mental health issues. I have seen people who are like scholars, like scholars who had like this type of issue. They have a trauma, and they had to take some kind of time, on their own and seek some medical help. So it can happen to anyone, irrespective of your religious background or whatever. Everybody is, can be prone to have mental health issues.
All right. Thank you very much, guys. Thank you, Ali. That was very clear. So let's proceed on to the next one. Like I said, the central question of this discussion is going to be like is mental health and education, knowing that like we are students, and then myself and most of us at some point have been there, especially for the fact that we've been away from home, away from your family, and then you have to struggle for everything. Ikram, maybe you don't experience this with us, but it's very interesting. So you when it comes to mental health and education, like how do you guys think mental health can affect like performance, like academic performance? Because we understand that sometimes if you, like you guys mentioned in the beginning, all these forms of mental health, the ways they can manifest themselves. For example, if you are stressed or you're depressed, obviously that is going to directly impact your medical performance. So can you guys please enlighten us on this? How can mental health affect like academic performance? From Ikram, please.
Thank you. I think, as you said, for you, the international students, there is a declaration on the rights of persons belonging to national or ethnic religious, and linguistic minorities. This is a declaration, for instance, when we talk about mental sickness, mental health. We also talk about the environment. That means if you face somewhat a form of racism, there is the declaration that protects you and gives you rights. You know, you have rights. So people need to speak up. First of all, like for instance, if there is an issue, you need to speak up. You need to defend yourself. You need to say no. This is my right, and I need to do this. And normally, the legal department or the jurisdictional department is with you. And then we have, for instance, for students that are for you, for example, the medical students, you have so many things to study. You have so many responsibilities. You think about your parents back at home, what they expect of you. I think the most important thing is to practice sports, have friends, and make relationships, and build your own extracurricular activities. Either practice sports or practice your hobbies more and more, even though somewhat we cannot have the enough patience to do something more than study, but it is really essential because it's like taking a break for your spirits. I think it's somewhat of this sorts, and thank you.
Thank you very much, Ikram. Juana?
Okay. All right, thank you. So, um, like I said from the onset, mental health forms a major part of our holistic health, of our general health. And definitely, if there's a problem with our mental health, it's definitely going to affect not only our academic performance, but all the various different aspects of our lives. Okay. And it's like a chain reaction. If our mental health is not sound, some of us may experience disorders with sleep. If we are having some kind of mental health issues, it can affect our sleep. If you are not able to sleep properly, you can't be able to study properly. You can't be able to give your 100%. You can't be able to concentrate at school. Okay, this is what happens. If you are not able to concentrate, well, what follows? Rattrapage. You're not able to understand what you are basically supposed to grasp at school, right? And then also, if you have some other kind of some sort of mental health disease, you're not able to socialize well in school or interact with your colleagues. Okay, and this can cause you to miss vital information or even seek the help that you need from colleagues. Okay, so this can also lead to other kind of problems and help you to and eventually cause you to perform poorly in school. So yeah, with regards to your question, how does mental health affect academic performance? In my point of view, this is what it does. So thank you.
Thank you very much, Juana. Alieu, you can go ahead.
Just like they said, actually, it's like mental health issue. Of course, like if you have mental health issues, like it's the risk of the affecting your academic performance is so high. Because imagine if you have all these symptoms, as you already said, you have problems sleeping, you have insomnia, you're not able to sleep well. If you're not able to sleep well, even if you study something, it can stay in your brain. Because when you study, you need to relax. When you relax, at the time your brain is assuming all this information, and you can also have concentration issues because if you have all this chemical imbalance in you, it can affect your cognitive capacity. So all these things, it's going to impact the way it's like. I actually had a friend, like I'll give an example. I had a friend actually in med school. That was a very close friend of mine. The person was undergoing like depression for a certain period of time. Nobody knew actually. I was the only one who knew. But that really affected his academic performance. Like actually, like that was an exam that he didn't turn up. I think the first exam he didn't actually turn up for that exam. So he went straight, but later the other ones he was able to come and I think I was able to validate some of them. But that really had a physical implication. Like I witnessed it. It was even like there was times that he was even having issues breathing like properly because of the level of depression that he was going through. So it can really seriously impact like your academic. Yeah.
Thank you very much, Alieu. Edie, I think you can proceed.
Yes, thank you very much for all those wonderful clarifications on how actually our academic performances are affected when it, due to mental health issues. Moving on further, I would also like for you to enlighten us on how can we as students, or what measures are there to assist us as students to overcome this mental health conditions when it comes to improving on our academic performance? Because sometimes when I see even me back then, I used to have kind of like a depressed. I used to be depressed. That used to be back in the days when I come newly, because I was having difficulty with the language, and also I've noticed that in schools actually most of the people don't speak French. Like I was expecting that when I come here, I'll meet people speaking French all over. So it was a different thing. So what measures are there that we students can engage in, or things that can help us as students to uh, improve on our academic performances and eradicate all these mental health barriers that are hindering us from our, our potential from achieving higher heights in our academic goals. I would like to begin with Joanna, then Aliu, then from there we can move on next time.
Okay. So, in my opinion, what I believe that we should do, first of all, as students here in Morocco or students all over the world, especially those away from home, first of all, mental health issues is nothing to be ashamed about. Right now, there's been so much awareness that has been created. We keep creating the awareness for the purpose of people to be able to be comfortable to speak about it and seek help wherever necessary. And then we're also creating the awareness also for people, for our entourage, our friends, family, people that detect these kind of symptoms to be able to reach out to their friends and help them also. One thing I'll advise is that don't isolate yourself. It's one thing that you should really take seriously. Don't isolate yourself, even if you feel like you are going through something. Try to reach out to people and have social interactions. It also is also good for your mental health. Another thing I'll say is that stay active. Staying active is very good for your brain and it helps your overall well-being. So make sure that you stay active, exercise, eat healthy foods. It's good for your overall well-being. It's good for your brain. Do things that make you happy. Like Ikram said early on, it's true that we are here principally for studies, but extracurricular activities are also important. Things that make you happy. Find what it is. Okay, it might differ from person to person. Maybe your thing is not going out to have fun. Maybe yours is reading a book, watching a movie. Find the things that make you happy and do them from time to time. Okay, and I think basically that's what I would say. And also, if you feel like you have a mental health issue, don't hesitate to seek help. Don't hesitate to seek help. There are so many platforms you can seek help, and then there's I think there'll be a segment for that. So I'll go much into details later on. So yeah, that's basically it.
Thank you very
Just
much.
to add, yeah, to what Joanna said, the first thing I would emphasize on is like this is something that I have seen in my life, like the impact that it has done in my life. It's exercise, like regular exercise, because I'm someone that I'm really into working out. Like I kind of work out 6 days, 6 times a week. But it's like it has so much like great impact that it's like I wish that I could even write an article, from the benefits that that I've been able to gain from working out. Like find time to just do exercise. It doesn't matter. Like you can do it for like 15 to 20 minutes or 30 minutes a day inside your own house or anything, or just go for a run or anything like that. Because when you work out, what happens? Your brain is like there's a release of what we call this, good hormones like serotonin, dopamine, endorphins. They make you feel so good, calm, and you have what we call increased blood flow to your brain. Even when you sit down to study, you feel like your brain things are very smooth. You can easily capture information. Why? Because you have worked out, and your heart, has pumped enough blood to the brain. So exercise, like it's a non-negotiable thing. And the next thing is to try to have enough sleep. It's very important to have like enough sleep. Like sleep, it's a key. It's like at least try to have. People vary, but at least try to have 7 hours or 8 hours of sleep. Yeah, it's very important. Sometimes I know we have some things, deadlines and stuff like that. We stay overnight, once a blue moon, that's fine. But don't do this on a consistent basis, like having lack of sleep, on a consistent basis. It's going to affect your mental health. And also like eating a balanced diet, like eat like try to eat healthy foods, try to eat healthy and stay hydrated. Yeah, I know sometimes you can be broke and you know what, hey, you don't care anything that comes your way. I understand we're students, it happens sometimes, but if you are, financially stable at some point, just try to treat yourself well, try to have as, healthy foods. And gratitude, like this is something that is like people don't take for granted, but gratitude, it has been shown like it has, like it reduce your level of developing anxiety like by 80 to 90%. Gratitude, like gratitude in a form is like you wake up, find 10 20 minutes, like 10 minutes before touching your phone or anything, like you can even stand on the screen or how to call on your mirror and you start thanking God. Okay, thanks for this, thanks for this, thank you for this. Like gratitude is, it's very very important. Like it's so wonderful. People don't, people take these things for granted, but it's very important. And another thing I also like challenge your negative thoughts. It's like whenever you have a negative thought, you can actively change that negative thought into a positive thought. If you have any negative thought, replace it with two positive thoughts. This thing can work. It does work because what happens is like your thoughts create your reality. So your cells actually, they don't know what is going in the external world. So what you receive from the brain, that is the way they are going to react. So make sure that you feed your mind with positive thoughts, and also like look for like good social interactions. Like talk to people. Have friends, positive friends you can hang out with from time to time, because people understand this. But communication is a form of therapy. People like that's why men like we really have like we do have these issues, men, a lot, because we feel like we don't want to talk because you have to be a man, you have to talk of us. Women are better in this thing because they can communicate to a friend and have this emotional stuff. That is a form of therapy. People underestimate it, but it's a form of therapy. It's very important that if you have a social positive social interaction or people that you can talk to, when you have certain issues, it's a form of therapy. But you can, despite these facts, like you can do all this stuff, but that's what we call is like the dimensions of what we call temperament. Like people are different, like based on the type of personality that you are born with. Some people, like, we have what we call this temperament is like some people are more prone to negative emotions because we have 5 types of temperaments. I don't, actually, but I don't want to go into details because time is going. But this thing, it can impact, even though if you do all this kind of stuff, like this type of temperaments, the type of temperaments you have, either you can be an extroversion person, like people who are extroverted, you get it, they are more prone to having positive emotions, like, but it also has its own downside. You also have what we call neuroticism. It's like these are people that are mostly sensitive, you get it, to negative emotions. So all those things, like, and people who are agreeable, agreeable people are people, they are very compassionate, and they can so carry all kind of stuff. But the problem with them is like they might not stand for themselves the way they're supposed to. So all of these like types of temperament, they have their own, advantage and disadvantage. You can also have consciousness and openness and stuff like that. But these things can
Okay.
play a part, in your how you can, be exposed to mental health issues or not. But I think the precautions that I have mentioned are very important. If you take them into consideration, I think you will be welcome, especially regular exercise.
Okay. Thank you
Because
very much.
exercise has been the only thing, like studies have shown that exercise is the only proven, like how to call it, experiment that a person can maintain their IQ, what we call intelligent quotient. You get it? There is not much you can do to increase your IQ. It's something that you kind of born with. You get it? But studies have shown it's like your level of IQ, because as you age, your level of IQ start to depreciate a bit. But exercise have been proven to be the only way, like for you to be able to maintain, how to call it, your level of IQ, especially like working out, like doing some lifting, weighting, and anaerobic swimming and stuff like that. Yeah. So
All right. Thank you very much, Mr. Peter, for those wonderful contributions. And I believe the audience will take into consideration, especially for the part of the exercise. I believe maybe tomorrow morning, all of them will be ready to just go to the gym.
hopefully, honestly. I'm looking
So,
forward to writing articles from on exercise and my experience, and
we are also looking forward to see it. So we can shift the floor to Madam Ikram. You're
Thank
welcome.
you. Yeah, thank you. I think my friends said everything. I just want to mention that, for instance, if you have depression, I think knowing the reason why you have a mental illness is a crucial point. You need to know why you are suffering from this illness. You need to study yourself and study your environment. For instance, if you're facing bullying, you need to train yourself to stop bullying or speak up. Or instance, if you're suffering from pressure from studying or from work, you need to lower this pressure by, I don't know, preparing beforehand, or there are multiple ways to be better, depending on the cause or the reason. So with that aside, I think, as my friend said, we also need to stay hydrated, or even in this heat. It's a crucial point as well. And also trying new things. When my friend Aliu talked about adrenaline and serotonin, when you try new things and when you face your fears, these pheromones, they develop in your body. So I think it's a way to avoid bad habits. For instance, if you try a new sport, or if you try climbing, for instance, you get the release of dopamine that is equal to trying a new substance or alcohol or other stuff like that. So by avoiding bad habits, you can try new things and having good habits. And which makes me mention my last point. It's bad habits. Avoid your contact with bad friends, and that encourages you to, for instance, going out at night, having parties. Yes, sure, once in a while it's beneficial, it's good, but once it becomes a habit, it's a bad thing, and you should really avoid it. And breathe fresh air. See things, see nature, see what God has created, see flowers, and also be appreciate, as Aliu said, thank God for what you see, and try new things, meet new people. It will all change and give you a fresh breath. Fresh patience to face your reality. And thank you.
And just one more thing, to just add one more thing I forgot about, like try to have exposure to sunlight on a
Yeah,
daily basis. It's very important because
vitamin D.
yeah, exactly. It's like the vitamin. It's gonna help you in the production of vitamin D, but also it's gonna help in your sleep cycle. That's what we call the circadian, how to call it, reading. It's like it helps you when you like for you to be able to get that melatonin when you are to be able to sleep well. So it's very important to have exposure to sunlight on a daily basis, at least maybe for 5 to 10 minutes on a daily basis. It's very important, because it's also going to help you in the production of vitamin D, because you need vitamin D, to get it's a vitamin that is very important because it's going to help you in the production of calcium inside your body and your tissues, especially your bones. They need calcium and stuff like that, so that you'll not suffer from osteoporosis as you're aging, because it's a bone disease that is very kind of common in women and people that don't have enough exposure to vitamin D. It's like in certain areas whereby they have so much like snows and stuff like that. They don't have much sun and stuff like that. They normally advise them to take supplements of vitamin D, because those people, they have high risk of developing osteoporosis. It's a type of a bone disease because they don't have enough exposure to vitamin D. That vitamin D is going to help us to combat like the production of calcium, and calcium is a very important element in bone, how to call it, formation and making your bones stronger. So if you don't have enough of that calcium, it can make your bones become weak and you can develop what we call osteoporosis. So it's very
Okay.
important to have exposure to the sun on a daily basis for 5 to 10 minutes on a daily basis. It's important. You don't have to stay for that long, because too much exposure to the sun too can cause you skin disease like melanoma.
Thank
So
you
you
very much.
just have to have a limited, exposure, because too much of
Ali,
too much of anything, can always be harmful too.
okay,
I
before
think
you
from
proceed with this, I want to add something to what Ali just said about the vitamin D and then sun stuffs. I think
Yeah,
I think like you just said, too much exposure can also lead to some damages, especially to things like skin cancer. So the remedy for that is like skin protection. We have sunscreens now everywhere, but from where I
yeah,
come
but
from, what should I say? Mm-hmm.
what
Like
would I?
in the African community, we think because we have our melanin, I don't know, is strong or something like
Yeah,
that.
it's
Like
true. It's
our
true.
skin
It's true.
produces
Yeah, that's true.
much melanin. We think we are not affected by the sun, so people don't protect. their skin.
Like, yeah, that's it.
So
It's
yeah.
like, the darker your skin, the more exposure you need to the sun. You get it? Because the darker your skin is a sign that you have more melanin. You get it? So, like, it's people who are kind of fair in complexion, they have less melanin. So those people they should be more careful on exposure to the sun. They can have
Yes.
exposure to the sun, but not prolonged exposure because they have a high risk of developing melanoma than people who are darker in skin.
Yes, I think, and that's why southern and northern countries like Canada, they have a moment where depression is really high if in winter because they don't have the exposure to the sun for 3 months or 4 months, and they have a high level of depression. Yeah.
Exactly. So the sun helps a lot, in so many ways. It's not our enemy though. The sun is not our enemy.
Yeah.
All right, thank you guys. Ili?
Okay, so as the discussion proceeds, there is a point that we actually forgot to mention, and I think it's better to bring it from now. You know, usually we are from different societies, and that give us a very good ground of communication, and also, you know, to put this thing out there to different societies because we are all from different backgrounds. So what I would like to say here is that how do we make our people aware? Like, how do we make people aware of mental health disorders or any other issues that is related to mental health? And how do we eradicate the stigma in the society for those who, they have been suffering from mental health disorders, especially coming from a society that, if you are suffering from depression, people who rather tell you, for example, if you are a man, they'll tell you you have to man up or something like that. So, or you talk about your emotions and they judge you according to something that you don't want. So how do we make our people aware of these disorders and how do we eradicate the stigma so that individuals suffering from these mental health disorders can have the courage to come forward or consult the necessary people in order to help them overcome this trauma? At least any of you can come forward.
Okay, I think the first thing I will talk about is sensitization. Like, which platforms are you gonna do to sensitize people? Normally, we can use the media. Call people, you get it. Let them make programs, on the media, and let them not make it in an international language or whatever. No, let them speak the language that most of the people understand. You get it? They can also be using some kind of billboards and stuff like that. But we can have these things, like maybe from time to time. But they can use the media. They can sit down and sensitize people. Talk about the different kind of mental health issues. Like if you have this type of symptoms here and there, you can go and consult. And make people understand that there's no stigma or it doesn't make you of a weak of a like less of a person because you feel depressed or you feel that and that. So those things, we can have those programs on our different platform, especially the media platform, and we make it in the language that most of the people understand. You don't have to necessarily make it in an international language or no, it's not necessary. But if you can use a language that most of the people understand, and also the use of billboards and placards and stuff like that, they can use those things to put it in maybe job places, workplaces, and stuff like that. They can paste them there, like this art, and they can make a picture of it, like signs of people who kind of look depressed. They write some of the symptoms there and stuff like that. Say in different types of every job areas and stuff like that. I think those things can kind of help. Maybe my colleagues will add other stuff.
Yes, I think also in our society, I just want to add one sentence. Also in our society, we have people that still watch TV. For instance, my parents they always watch TV more than they use social media. So I think it's crucial to have international national programs talk about mental health, and also in mosques. For instance, in Jumu'ah, when we have the imam talk about phenomena, they can mention sometimes mental health and sensibilize people and stuff. And thank you.
Thank
All
you very
right. So
much.
the little I have to add is that yeah, let's try to participate and encourage others to speak up. And I mean, it starts from individuals, right? Creating the awareness and encouraging people to speak up about mental health. Let's try to encourage others when they speak to us. And also, don't be afraid to go and consult if you feel like you have a serious mental health disease. You can speak to any medical student, right? If you feel like you're going through something, and they will direct you to where to go, right? You can also walk into the hospital and you'll be directed to the proper place that you're supposed to go. You can go to any doctor and consult. Those the students at the city, I think they know this. You can go to the doctor if you're having issues. She will refer you to a psychologist. Okay. Also, we have international platforms like BetterHelp. I don't know if you've heard about it. There's BetterHelp, which is an online platform, and that offers therapy to people. You can go online and search that if you need any kind of therapy help for a subsidized price. I think you can get students discounts, and yeah, it's very safe, secure, and everything is confidential. So yeah, one other thing is that, like the others have said, try to make yourself happy. Don't isolate yourself. Don't hesitate to speak up. And remember that you are not alone in this. So, thank you very much.
Thank you very much. Those are all wonderful contributions, and I believe the audience will grab a lot of important information from all those points mentioned. And absolutely, you are all right, because when you look at the situations, different societies have different ways or different platforms in which they are most active in. Maybe when you go to other countries, it is radio stations, other countries, TV stations, social media. So maybe based on the type of country that we are from, we can actually um, sensitize our population based on the activities they are more indulged in, maybe browsing social media or watching TV 24/7. Like the song also mentioned, like in Juma, in which when the Imam is giving khutbah, also so that people would actually grasp a lot of important information from what is being said. Thank you very much. I believe from now on I can hand over the floor to Madam Jalop.
Thank you very much, Idris.
Madam or mademoiselle?
Madam, Madam, Madam Lade.
I never heard you
Okay,
were married.
Uh,
you can Madam,
okay,
but
whether married or not, I'm still Madam.
Okay, that's
Done.
fine.
Anyways, thank you guys. Like it's been very interesting. But I think we only have 7 more minutes to go. We are almost at the end of this program. So unfortunately I couldn't access the Facebook to see if we have any question there. But from I saw a question here saying like okay, like what are the stages of overcoming stress? Like, okay, these stages. Okay, let me just leave the question to you guys. If any of you can come forward, and help this
Okay, I think
particular person.
that's a question from Balde, right? Okay, what
Yeah,
I would
Asan
say is
Balde.
this. Yeah, what I would say is this, Balde. You need to identify what is causing that stress in your life.
Mm-hmm.
Because I think the solution to permanent solution to any pathology or anything is identifying the cause. Because you can use a treatmentic symptom, you get it, like you can just treat the symptoms of a particular thing, but in as much as you don't actually find the root cause of it, you will always have a relapse. That's why in medicine, even if you have a patient that presents with certain symptoms, okay, we can treat the symptoms at that time, but we are going to make some investigations to actually find the actual cause. And once you eliminate the cause, the symptoms will disappear automatically. So I think the first thing you have to do is identify the trigger. What is the thing that is causing you stress in your life? Once you're able to identify that, then you will be able to find a way to deal with it. I believe that that helps. Trying to identify the trigger that is causing stress in your life, and ask yourself, why is this even causing you stress? Because I think sometimes we have the power to we have the power to react to a situation. Okay, maybe I can just sit down. Okay, maybe I look at Khadija, understand, or maybe I just look at Idris and I said, okay, Idris, maybe I just say something kind of a bit rude or something like that. Idris can look at it and like, you know what, do I have to respond to this guy? It's a waste of time, just forget. Or he can choose to react to it, and get emotional, all kind of stuff. So I think we have the capacity, to control, the way we react to external factors. because most of these things are external factors. You get, so you have the power to to either decide to react to it or not. Sometimes I can just look at my phone. Maybe someone will send a rude message. Like what? It's a waste of time. If I have to reply this person, it's gonna be throw and fro. Just forget it. It's cool. So you have to identify the, how to call it, the trigger in your life. And why is it causing you a stress? It has a lot to do with you, because maybe you are giving it like more, how to call it, more emphasis on your life than it's supposed to have. So just like try to identify the trigger, and you'll be able to find the solution eventually. I think that helps. So my colleagues have anything to add?
Thank you very much, Ali. Juan and Ikram, do you have anything to add to this? Ali just mentioned, after like from the identification, or do you guys have anything to say?
I
About
think
this
for me,
particular
I
topic?
think yeah, I think after identifying the trigger or the problem, you need to also ask for advice. We have many blogs. We have people that you can't be alone in this. You can't be the only one that experiences this problem or this stress. You can ask other people, like for instance, older people, professors, or you can ask them, how did you deal with this stress when you were in my place, when you were in my shoes? They will give you tips. They will give you some guidelines to follow. And it's not really, sometimes when we focus about our life, we think that some issues are really major problems, that they're gonna cause really major deals or something like this. But once we step out, we take a bigger look, we take a wider look at our life, we realize that this issue may not really be this important, that life continues either way. So you need to take a step back, ask for advice, and as Joanna said earlier, speak up. You are not alone in this.
Okay, and just to add to that briefly, I feel like a part of growing up is developing your mindset, right? And deciding the kind of things that you allow to stress you and not. I think growing up, you have to learn a lot to strengthen that muscle in you, right? So, aside identifying what the stresses are, and then seeking advice from other people, develop a strong mindset, identify the things that you can change and the things that you can't. If there's a possibility that you can find a solution to it, waste no time to do that. Waste no time to seek advice. Waste no time to seek solutions to what is causing you the stress. Okay, and then move ahead with your life. So that's the little I have to add.
Thank you very much, Joanna, Ikram, and Aliu. I'll just add a little to that. I think um, why am I being stuck? Anyways, Joanna said before, like if things like this persist after identification, if you see that it like it's not going anywhere, maybe it can be depression. When it's severe, it's very necessary to seek professional help. Like Joanna mentioned, most of us, we are not very used to seeking help when it comes to seeing therapist or maybe psychologist. I think it's high time we start like considering these things if necessary. But also sometimes if it's not that severe, if you realize that you're just being stressed out, or one particular thing is been bothering you, sometimes it's necessary to open up to people. Like, it's necessary for everyone to have a confidant, someone you can open up to, someone you can talk to, because it can be helpful. For me personally, I'm the type is very therapeutic for me when I speak, when I say things. It's I overcome them very easily. So I think also it's very important, because this thing goes hand in hand with growth. So it's important for everyone to know themselves, what how you can heal, just understand yourself, your body, your mind, how you function, and then what you can do for yourself if you are in certain situation. Because if you don't save yourself, the world cannot help you. You'll just be suffering, and then no one will be aware, and then it's very dangerous, because it can become very, very destructive. So yeah, I think we still have a lot to ask, because you people, this conversation is going on great, and then people connected, people are really enjoying it. And then it's obvious that you the both of you have a lot to offer. But unfortunately, we have some time constraints, so therefore we will just proceed to the closing remarks or final words. What do you guys have to say? What are your final words? Yeah,
Sorry,
so anyone can start.
So what
sorry.
I was okay, Idris, you wanna okay,
Yes,
go
I
ahead.
found it is really very important. Although there are lots of questions that are prepared, but as the discussion is going, but let me ask this one. So from there we can proceed to the conclusion. If I thought it would be okay. And the question is there a possibility for genetic factors to hinder a person's mental health,
Yes,
or are there genetic factors?
yes, exactly. That's why we didn't talk about it, but we should have talked about risk factors. I was
Mm,
kind of trying to explain what the dimension of temperament. I was trying to say that because this temperament has a lot to do with your, the way you were born genetically. There are certain people who are more prone to having like how to call it like mental health issues because they are more prone to negative emotions. You get it? It's like genetic factor can play a significant role. Like it can play a significant role in how somebody like how to call it the rate at which somebody can be exposed or develop mental health issues. Yes, it can play a very significant part. It's like among the five type of temperament, how we call neuroticism. It's like these are people that are very, very like they're very, sensitive to negative emotions. It has its own good, it has also its own like good part. It's like advantage like these people can easily sense danger, before anybody else, and they can save
mm,
themselves and other people, you get it. But genetic factors can play a very significant role because it's among the risk factors even. Yeah, it's among
Okay,
because we have the risk factors that are
that's
modifiable and
very
that are non-modifiable. So
yeah.
among the non-modifiable ones, you have genetic factor. You also have gender because generally it has been shown by studies that women are more prone to how they call it like mental health issues than men. There's a study that has proven that. So gender, these are things that you cannot change. Your ethnicity, your nationality, these are risk factors that are not modifiable. Other risk factors that are modifiable, you can have how to call it. You can have maybe occupation. You can also have how to call it like your social environment. You know, those things are modifiable. Your financial status and things like that. Because yeah, but the other ones that are not modifiable, genetic factor can be part of it. There are people who are more prone to it. They
I
can
think
play.
that's very well. That's very well said. Sometimes the cause of a mental health illness is not known specifically, but there are several factors. Like Aliu said, there are environmental factors, and then there are also genetic factors. So, is that if somebody in your family has had a certain mental illness, it's a possibility that it can happen for another person in the family line. So yes, genetic factors are really a factor to consider as a cause of mental health.
Idi, is your question been answered?
Yeah, absolutely.
Ikram, do you have anything to throw to add
Yes,
to this? Or?
I think there is also a correlation between how much people think and the level of depression they have. Like
Mm,
I read somewhere that the higher the IQ, the higher you are prone to have depression. I don't know if it's logical or not, but I read it somewhere and I just remembered and I wanted to share it. So
Yeah, it's true. It's true. I've read that too somewhere in Quora. It's true. I think they say that people who are like that have high IQ, they're mostly prone to negative emotions because they overthink a lot.
yeah,
So the thoughts is like this. This is like most of the thoughts is like all of this problem. Most of them they generate from our thoughts. That's why they say that your thoughts like and feelings like they create your reality. So if you're able to think positively, you have a very like quality life. So people who have high IQ, very high IQ people, they're very exposed to this because they have increased brain activity, most of them. So it's difficult to sort off their brain. So they keep thinking. Even when they go to bed to sleep, it's difficult for them to sleep. Some of them because they have increased brain activity. So most of these high IQ people, what I've realized, like They are mostly night owls. These are people that normally they are very active during the night. They do most of their studying during the night. During the day, their brain is kind of a bit dull, but during the night, that is where they have increased brain activity. So it's difficult for some of them to sleep sometimes. It's difficult because the brain, like the impulses are firing, So they keep overthinking stuff. It's difficult to shut down their brain. That is
Yeah.
true. Yeah, I've read that somewhere. It's true.
All right. Thank you very much, Aliu. Edie, I hope that answered your question. Although I would like to add something like
Are you satisfied, Edie? With the
Of course,
answer?
thank you very
I can
much.
see you smiling, so it feels like you're satisfied.
okay, talking about the risk factors before we proceed to the final remarks. Edie, I saw your question, but unfortunately I don't think time will permit us because Abdullah have been writing in the chat box like it's time since I think 5 minutes ago. So
Sorry,
I'll
sorry.
just add one point to the risk factors. You guys talked about genetics and then environmental factors. I'll also mention CPTSD, like childhood post-traumatic stress disorder, because children that grow in certain environment, like or maybe like in certain families, for example, kids that grow up with complete families, whole families, having both their parents there, and then if the parents are whole owner, for example, if they are alcoholic, they abuse drug on, or maybe like any other problems that they are facing will directly affect that child when they grow up, and then it can transform into something very very, it can manifest something, sorry, into mental health, maybe disorder in some sort of way. Okay, so I just wanted
Like
to
child
add that
abuse,
point.
child abuse, as you said, you're right.
Yeah,
That's bad.
child abuse like molestation and all those. So
Yeah. Child abuse,
CPTSD.
even a child that was raped from a young age by an uncle or whatsoever, all those things can lead to mental issues if the child
Yeah,
goes through, those things.
yeah. All right, thank you very much, guys. So we would like to proceed. You can say your final words before we end this discussion. Although it was a very fruitful one, I must comment that. So anyone can start. Maybe lady. Okay, Ali, go ahead.
Yeah. Let me close it. This lady started it, so I can close it. And they will finish it.
All right, go ahead. You're right.
Yeah, so what I would say is like, honestly speaking, I know it's like the purpose of life. Everybody wants to be happy most of their time, cool and stuff like that. But what I would say is like, seek meaning. Try to seek a meaningful life. If you have a meaningful life, the product of a meaningful life is happiness. I tell people, don't seek happiness directly. Just seek a meaningful life. Once you have a meaningful life, the product of that is happiness. And there are three things in you that you have to take care as a human being. That is your mind, your body, and your soul. These three things, they all have requirements that they need. If you give it to them in their required dose, you will be stable for the most part of your life. Your default in life will become happy. Honestly speaking, yeah, your default will become happy. But it's very important. Take care of these three things: your thoughts, your mind. It's very important. Your body and your soul. Your body, exercise, eating good food and stuff like that. And as far as your soul is concerned, irrespective of your religion, you know what to do spiritually to keep your soul, healthy and alive. So if you're able to take care of these three things, I'm sure like your default in your life will be happy. You'll be happy for the most part of your life. And if you're happy, there's a high chance of longevity. Like you can live longer in life. Yeah. So
Definitely. Thank you very much, Aliu. Joanna. Okay.
Okay, all I have to say is that um, we all have just one life to live, and your mental health is very important to those around you, to your loved ones. I always say, and I just want to reiterate that you are not alone, right? Seek the necessary help if you do. Remember that your mental health affects every other thing that you do, so make sure that your mental health is intact. Protect it at all costs, and seek help if you need help. Basically, that's all I have to say.
Thank you very much, Joanna. I almost said Ikram. Joanna, thank you very much. All right, Ikram.
For me, I just want to thank you for the opportunity, and I just want to say that being good in a mental way, it's a human right. It's an international human right. That means it's your right to be healthy, either in your physical state and your mental state. So my advice and the technique I use is that I use writing method. I set my, for instance, a 30 years goal. And I enjoy the process to get in that goal. I don't stress enough, for instance, with 30 years you have enough time to think about it and to act upon this goal, so you enjoy the process, you try to enjoy the process as much as you can, you go out, have fun, enjoy your life. As Joanna said, there's only one life. Exercise enough. It's easier said than done, I know, because we suffer sometimes. When you have too much stuff to do at school, you can't have the time to practice or go out or meet friends or etc. But you need to try, you need to enjoy the process, you need to hustle. And when you hustle and work hard enough, at the end the results, it will be enjoyable, it will be worth the per se the suffering. And thank you
Mm,
so much.
And I re-emphasize on the exercise. It's like, please
Yeah,
exercise, man. I do it. I'm telling you, it's gonna
anyway, yeah,
yeah, it's gonna increase the quality of your sleep. Yeah, it
any
will
type
come
of
to a point you
exercising.
might not even, yeah, you might not necessarily need to sleep for 7 hours. You can sleep for 6 hours or five and a half, and you will still feel alive and like very active. So please, like, just try to like inculcate, like, have it called working out in your daily routine. You will see
And
the
seek,
impact,
yeah,
honestly.
and seek
And
help and talk to us, yeah.
exactly, it's going to increase even your self-esteem as a person, especially for a guy. It's really going to increase your self-esteem. Yeah, you're going to feel much more confident about yourself, not in a cocky way, you get it, but
mm.
you're going to feel much more confident about yourself. It's so wonderful, honestly.
All right, guys. Thank you. For me, like I've learned a lot about this topic, and then what I retain more from. Okay, Ikram, is the fact that even no matter how busy we are, we should try and squeeze our social life, have time for to do things we like, in a nutshell, which is very very crucial. And then Joanna, like what I retain most is we only have one life to live. That's it.
Yeah, they
I
say that
really like that
they
phrase.
call it YOLO, right?
Yeah. Oh yeah, I know. I know. Although
Yeah,
most of us
exactly,
can twist
exactly.
that
You're
and then abuse it, you know. But yeah, as you said, Joanna, we only have one life to live, and then your mental health can affect every other aspect of your life. So yeah, that is also very, 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 very crucial. So Aliu, like what I retain most is
Exercise.
you should take, yeah, exercise, eat balanced diet, and everything, meditate and all of that. But also most importantly for me is like take care of your soul, mind and
Body,
body,
sorry,
body,
body.
yeah,
body.
soul, mind and body. So I'm going to take these points I just mentioned home with me. So guys, thank you very much. It was really 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 an amazing session. Like it was very interactive and
It's a pleasure.
informative. We can say thank you enough, especially to Ikram and Joanna and Ali. Thank you, like you're part of the leadership, like you've been doing a lot already. And
It's
so
our
we
pleasure.
like hope to
Pleasure.
see more of you. So thank you very much. But before we go, Idrisa, in case you have something to say before we end this.
Thank you very much. First of all, my attention will move on to the viewers, then I'll come to the panelists. Um, to the viewers, I hope you have enjoyed this show, and I hope you learned a lot from the discussion, and I hope also you act upon as the advice given by our panelists. And we are looking onto you, and we are looking forward to you to be engaged in a lot of discussions in the future. And we also encourage you to be participating because discussions like this are really important when it comes to both our health, our academic, and our social careers. So I advise you all to be joining us in this kind of programs and also come up with your questions. Any doubt that you have, you can come up with it. And I believe our panelists will try their best to answer the questions to the best of their abilities. And to the panelists, also it's a pleasure to have you here today. I know things might be rough and time things might be rough and sometimes you might have a very tight schedule, but you actually sacrifice a lot. And then today you are here and you join us to this wonderful and beautiful discussion. And I would like to thank you for that. And also, we are looking forward to meeting you in other future discussions. And I hope we also, as the host, will also learn a lot from the discussion and also practice and what the advice you already gave. And nonetheless, it's a pleasure to have you. And thank you very much.
Thank you
It's
very
been a
much.
great pleasure to be here. I just want to say kudos to you, the GASAM administration, for creating this kind of avenue.
Yeah,
You guys have done very well. Keep up with the good job. Yeah.
yeah, the
It's a
executive
pleasure.
and the
Thank
media
you.
team are doing a good job. Honestly, it was a good,
Yeah.
good proposition.
I
Helping the
just saw
youth.
someone from the audience specifically asking me to exercise Adamaba. So I do exercise for your information. But anyway, to our panelists,
If you
thank
need
you
somebody
very
to
much.
coach you on how to start exercising, you can contact me. I can coach you on how to start with
You
minor
can be my
exercise.
coach, Ali, if you don't mind.
Yeah, but
You
I'm
will be
gonna
my
raise some
coach.
funds on it. It's not gonna be free. I have to start raising funds.
Don't worry, I'll pay you well. Don't worry, that won't be a problem. So, guys, thank you very, very, very much.
Alright,
It was
Thank
wonderful.
you.
Thank you, and have a good night.
Thank you.
All
Bye
right.
bye. Bye bye, everyone.
Bye.
Bye.
Ikram, see you at
See you
school.
at school tomorrow. Bye
Joanna,
bye.
see you next time. Ali.
alright, alright.
Bye.